My name is George Carman. I'm 45 years old. I live in Gloucester. I'm a firefighter up there. I was born with cystic fibrosis, and it was, I believe, November of 2006 when Dr. Carman had recommended that I go be evaluated for a lung transplant. And over the years, I went to Manhattan down to New York Presbyterian Hospital to be evaluated. So we set up a little organization called New Lungs for George to help raise money for unpaid medical expenses. From the time I was a child through high school, I wasn't in the hospital much. And then after high school, I was in the hospital more. And then over the past 8 or 9 years, I was in the hospital probably every 3 months. And then over the past 2 years, I was in the hospital a lot more than that. It was November of 2010 that I was in, and I was probably in the hospital more than I was out of the hospital until I got transplanted. I was put on the transplant list September 3rd of 2010, and I got the call exactly 5 months to the day, February 3rd of 2011. I was admitted at Maine Med, and it was about 6:30 in the evening, and we had it all set, just to back up, sorry, to back up a little bit, that I was going to be transferred down to New York Presbyterian Hospital because I was too sick to travel. So Dr. Zuckerman and Dr. Arkasoy down in New York had talked, and I was going to move to Manhattan until I had the transplant. And I was all scheduled to be discharged from Maine Med and be admitted into New York Presbyterian and finish my 2-week stay. And it was on a Wednesday evening, and the nurse comes running down to my room and says, "New York's on the phone." And I said, "Okay, it's probably just about my transfer tomorrow." And of the 2.5-minute conversation with her on the phone, and I know, they have to tell you the age, the sex, and all that of the donor, the only 2 things I got out of the conversation was, "We're going to fly you to Manhattan, and we're going to prep you for surgery by 3:30. And I said, "Excuse me?" She's like, "Oh yeah, we found a donor." And it was about 9:30 before I left, before we had all the paperwork done, when Dr. Mehta finally came down with all of my discharge transfer papers to transfer out to New York. They couldn't fly me down because we was having a blizzard. So I ended up riding for 6 hours in the back of an ambulance. And the guys who drove me down were actually other firefighters that I actually trained. And as they put me on the stretcher, I said, "Can I drive?" And they're like, "No." I said, "I promise I'll get out a block before the hospital and switch so they won't see it." But they still wouldn't let me drive. We ended up in Manhattan about 3:30 in the morning. I got there, signed more paperwork to have my lung transplant than I did to buy my house. They started instantly putting immunosuppressants into my IV. They started prepping me for the surgery. It was about 11:30 that morning when they finally came down and got me and brought me to the OR. And that's when it was about a 10-hour surgery. And I will tell you, I never felt this awesome before. I have never had a lung function higher than about 87%. When I went down to Manhattan, I had a 19% lung function. And when I left Manhattan, I had 111% lung function. And they don't tell you a whole lot about the donors and what, because of HIPAA, the donors don't know a whole lot about us. They did tell me it was a 17-year-old boy, and he helped 8 people. The transplant process itself, at the hospital I was at New York Presbyterian, it was an excellent hospital. The nursing staff, the hospital staff, transplant specialist, and any question you had, any side effect that was going to happen with the med, they knew about it. Don't worry about it. They didn't seem to be concerned about a whole lot of things. Yeah, that's common. This is some of the meds cause ulcers in my stomach from the immunosuppressants, which is the Prograf, the Imuran, and the prednisone, and all those had caused ulcers, so I had to go see a gastro doc because of the ulcers. And then they always put everybody in pulmonary rehab. Dr. Tavidio, who was my surgeon, said he's been there for 18 years. He said, and I put every patient through pulmonary rehab. Once I got back up into my room, I said, when do I start pulmonary rehab? And he said, you don't have to. He said, because you walk in the halls, and when I get discharged, the physical therapist came to the house, and she said, we don't have to put you in pulmonary rehab because our patients don't have a 98% lung function 2 weeks out of surgery. They said, so it's obvious that you're doing fine and you don't need that. The only complaint I had with New York Presbyterian was the food. Maine Med Food has it all over there. I figured I'm going to New York and I'm going to have some awesome food because they got awesome cooks. It's not at New York. And I told the doctor, I said, you know, the food here stinks. He says, you're not here for the food. And from my personal perspective, the overall transplant experience down there was awesome. It's hard to explain the feeling when you wake up, and it was probably 12 hours after surgery. It's about 9 o'clock Thursday morning that I woke up, or Friday morning, I guess it was. I don't know. I had no idea of the time of the day, and it's hard to explain the feeling when you wake up and you can take in a deep breath and you can exhale. You don't have to have oxygen. It's a weird feeling. My wife, my sister-in-law came in the morning after I was in ICU. She whips the curtain open and she's like, holy cow, you've got color and you're sitting in the chair. And I'm like, well, where did you think I'd be sitting? You know, I didn't want to stay in bed. I wanted to be up moving, and in just 12 hours, I get my skin color, and I didn't notice it, but I guess everybody who knew me afterwards, in just a short period of time, said the color comes back and everything. I mean, my energy level, everything has just, it's unbelievable how well, you know, the process is. My biggest, I've spoke at New York with their pre-transplant patients in their seminars, and the biggest advice I can give to them is exercise. Exercise, exercise. And I told them, I said, I know it's hard. I said, I was on 8 liters of oxygen with exercise, and I didn't like to walk because I couldn't breathe. I said, but I'm convinced if I hadn't have exercised beforehand, I wouldn't probably be as well as I am today. They said typically they don't like to let their patients within an hour of the hospital for up to 6 months. I spent 79 days in Manhattan, and I was going back every Monday to the doctors for checkups. They check your PFTs, all of your labs, and x-rays because of rejection. That's how they can tell if there's any form of rejection. And then it's every other week, and then every third week, and then once a month. And I skipped the others and went right to once a month. Actually, next Monday I'm heading back down for my first month's checkup since I've been home. And that's about it. Unless somebody has any questions that they'd like to ask about the process or anything that...
I'm sorry, did I understand that you just had your lung transplant?
I did, February 3rd of 2011.
February 3rd, okay.
So now I have 2 birthdays, I told my wife.
So you're coming up with it's incredible.
So does the scare of rejection always going to be imminent, or are you past that stage?
It'll always be imminent. The first year is the most crucial. Some of the things they tell you to stay away from is babies, because babies have live vaccines. No raw fruits, vegetables, no blue cheese, feta cheese, cold cuts, anything like that, because they're like sometimes they set out for a while and they're not prepped right. Buffets, I can't mow the lawn. That hurts my feelings. Sorry, honey. I'll buy you a new lawnmower. And that's because of the mold that's on the grass. And I said, what if I have a mask? And he said, no, the mold spores are way too small. But that will all get better. The immunosuppressants will come down over time. I'll take less. With my creons and my immunosuppressants, I'm at about 60 pills a day right now, which for me is, I'll take that over 2 hours of breathing treatments in my vest and, carrying around my oxygen and all that. That's a small price to pay.
I heard you on the radio yesterday morning.
Yes.
And I understand there's a tremendous financial burden that accompanies a transplant and the care that has to follow afterwards. And I wanted to know if there's information available for us to view for any help that we can give for your future treatment.
I haven't seen any so-called figures because it depends where you go and how far away you are from home. For instance, I lived in Manhattan, so we unpaid medical expenses are your most huge. My health insurance paid for the operation, and so far I've gotten all the bills, and we're up to about $600,000. It's almost a $1 million operation. Food, lodging, that type of thing. My apartment in Manhattan was $5,600 a month. And the hospital there did not have, they had rooms that you could go, but you had to share bathrooms and kitchens. And, your immune system is suppressed, so they really don't want you sharing bathrooms and kitchens with other people. So we had an apartment, traveled to and from the hospital from there. It was a $40 cab ride one way, so it's $80 back. The first month's immunosuppressants, I got the bill from the health insurance. They paid $12,900. I paid $522 for co-pays. So it's there's really no set figures that I've seen from all the research we've done to try to find out. What we did do is we called other people that had transplants and where they went, where they lived. The geographical locations, and figured out how much money we would need to go through the process. And we figured on the worst case scenario that if I had to stay in Manhattan for a year, that I would need up to $500,000 for that. And we always figured on the worst case scenario. That way we wouldn't be cut short.
How many years did you and your fellow firefighters do the fundraising?
We started, our first fundraising event was November of 2005, and my first visit to New York was February of 2006. And to date, we raised about $230,000. And that was all kinds of fundraising events. I can tell you, if I wasn't a firefighter, it'd be a lot harder to raise the money. Because it's the fire, police, EMS is a huge family. It's a brotherhood, and they stick together. And it's a lot easier to raise the money. I don't know if you guys saw the news. The homecoming was just unbelievable. I got to drive the truck. I put my pants on and said, now I'm home. I'm not back to work there yet, which hopefully I'll be back to my regular job in September. And hopefully on Monday when I go, he'll give me clearance to go back, at least do some firefighting stuff, but it won't be the whole thing that I'd like to do, but at least I'm there. Anybody else? Questions? You guys can see me after too and ask questions, and we have Facebook if you want to follow the progress, and if you guys have questions about the transplant or fundraising, just give me a holler anytime. Thank you.